Welcome to this video on elbow arthroscopy from Veterinary Specialist Services. Elbow arthroscopy is used for assessment and treatment of the elbow joint in conditions such as medial coronoid process disease or elbow dysplasia. So fragmented medial coronoid process is a common reason for this treatment. You can see here that there's an osteochondral fragment at the tip of the ulnar medial coronoid process that's being elevated by a hypodermic needle used as a probe. And we're just gently manipulating it to relieve it of its attachments to adjacent soft tissues and subchondral bone so we can remove the fragment. This treatment is performed most commonly in young dogs where this condition is diagnosed relatively early, and perhaps they had a forelimb lameness that improved with rest and anti-inflammatories, then recurred, and radiography or CT was then performed to increase the suspicion of medial coronoid process fragmentation or diagnose it definitively. Here we've got a set of arthroscopic graspers, and they've been introduced into the joint. And once the fragment has been released, and we're going to grasp the fragment and carefully remove it from the elbow joint, and thereby taking away that piece of mobile bone and cartilage. Following this, we need to assess further the tip of the coronoid process, particularly if we're aware of a fragment in the radial incisor, which is the portion of the ulnar coronoid adjacent to the radial head in the background. And we're going to palpate the cartilage and subchondral bone, looking for malacic or soft areas that might need to be treated by debridement. And so we've got the probe in here, but now we're going to pass in the curette and very carefully debride any remaining loose cartilage to try and smooth out that joint surface as best we can. Here we've got subchondral bone bed following debridement with curettage and of the cartilage and bone with the curette, and we're just palpating down that radial incisor looking for fragments that we might need to remove, and this is now clear of those fragments. Some dogs have more severe osteoarthritic changes associated with their elbow dysplasia, and the next video is an example of that, where you have more normal cartilage up towards the trochlear notch, and then we head back down into the coronoid process, and you can see the displaced cartilage, fibrillated cartilage, and exposed subchondral bone both ventrally and also on the humeral aspect of the joint. Ununited anchoneal process is another manifestation of elbow dysplasia, and here you can see the arthroscope looking up towards the anchoneal process in the top, and the ulnar is being moved and showing the fissure between those two bone sections there. I'm David Cook. Please contact us at Veterinary Specialist Services if you would like to discuss elbow arthroscopy as treatment for your patients or pets.